Welcome to the Dental Capsule. In this series, we'll cover different dental topics and real clinical situations in short, easy-to-follow capsules, designed to help us improve how we manage our daily cases.
In this capsule, we're going to talk about how to manage broken roots or root tips. Let's imagine this situation. You're extracting a tooth, and suddenly you hear a loud crack. The tooth gets loose, you take it out, but part of the root is missing. Now the big question is, should you go after the root and remove it? Or should you leave it in place? There are three main factors that help us make this decision. First, the size of the remaining root compared to the socket. There isn't a fixed rule or exact ratio, but in general, if the fragment is less than half the depth of the socket, it's usually okay to leave it. That's because there will still be enough bone for the blood clot to attach, organize, and start healing. For example, in this case, the broken piece was small, there was enough space for clot organization, and healing was complete. But here, the remaining part was large, and there wasn't enough volume for the clot to organize, so the extraction had to be completed. Second, the condition of the tooth or root before extraction. If the root or the tooth was surrounded by infection or an abscess, it's better to remove it. Healing is very unlikely if infection is already present. And more importantly, if the root contains foreign material like gutta percha or any type of restorative material combined with infection, it definitely should be removed. Otherwise, the socket will not fully close and healing will be compromised. For example, in this photo, the root is surrounded by a periapical lesion and has endodontic filling material. In this case, even if only a small part remains, it must be removed. This X-ray also shows a similar situation. A remaining root with infection and filling material that led to recurrence of the problem. Third, the proximity to vital structures. Sometimes, trying to remove the fragment can cause more harm, especially if it's close to the maxillary sinus or the inferior alveolar nerve. If the fragment is small and there's enough bone above it for blood clot organization, it's usually safer to leave it. But if the fragment is large or removal is risky, it's best to refer the patient to an oral surgeon for better management. For example, in this X-ray, the fragment is small and very close to the inferior alveolar nerve. In this situation, it was left in place safely. To sum it up, if the broken part is small, covered by enough bone, and not infected, you can usually leave it, and healing will take place. But if the fragment is large, half or more of the root length, or associated with infection, especially with filling material, it should be removed. And if removing it is risky or difficult, the patient should be referred to an oral surgeon to avoid complications.
Thanks for watching. If you found this helpful, don't forget to like and subscribe. Share your thoughts or questions in the comments. We'd love to discuss them with you. See you in the next capsule.